Hello, everyone, and thank you for joining us this evening for the fifth week of the RISE Institute and Rugby Research and Injury Prevention Group 2026 Summer Lecture Series. My name is Siddhant Parachuri. I am a rising senior at Lynbrook High School from Cupertino. I'm a 2026 RISE intern, and I'm looking to go into sports medicine. Before you start presenting, could you please share a bit about your background and give us a brief introduction of what you will be teaching us about today?
Yep. So I'm James Robinson. I'm a primary sports medicine physician at the Hospital for Special Surgery. And so I'm gonna kind of talk to you about how I kind of went from being in my career as a sports medicine physician, all the way from taking care of high school athletes all the way to the professional level, and kind of the differences of each kind of level and what kind of level brings different challenges, different expectations. Um, as I've kind of had a great opportunity to cover a lot of different things. So, um, so kind of where it all started. I grew up playing sports, probably like most of you did that are interested in sports medicine. So I was, an athlete all my life. When I was younger, I played every sport, football, soccer, baseball, basketball. And then in high school, I played soccer, tennis, and volleyball. And then I went on to play tennis at a Division III school in Huntingdon College in Montgomery, Alabama, where I grew up in Alabama. And those are our lovely tennis courts there. Um, and so kind of how I got interested in sports medicine originally. So my senior year of going into my senior year, my summer between my junior year of high school and senior year of high school, I was at a club volleyball tournament. I went up to make a jump set and kind of misjudged the ball, and the ball was a little bit further behind me than I thought, and kind of went like back like this and just dunked the ball over the net, and kind of felt a pop in my shoulder. Didn't really think much of it. Didn't really hurt that much at the time, but just kind of felt a pop. Felt a little weird. I played the rest of that day, and we were lucky enough to make it into the finals. And by the time I went to serve in the final, I couldn't raise my arm over my head because it was hurting so bad. I ended up seeing a local orthopedist and had an MRI that showed a labral tear in my shoulder. And pretty much the only option I was given was surgery. I wasn't given any conservative management or any kind of treatment other than surgery, which for those of you that are familiar with labral surgery as a overhead athlete, you're talking about a 6 to 12 month return to sport. And so that pretty much would have ended my senior year. I am 5'9" male, so collegiate volleyball was never in my was never an option for me. It kind of would have ended my career playing volleyball. And at the time, I wasn't even sure if I was going to play any sports in college, as I was wanted to be pre-med and really wanted to concentrate on my academics. And so Obviously, I did not have surgery. I sought a second opinion. I saw a sports medicine physiatrist at that time who recommended just PT. And I did very well with PT. Was able to play tennis throughout my entire college career with very little problems with my shoulder. So that kind of is where I started in sports medicine. And so I went to medical school, and these are some pictures from intramural medicine, medical school. So you can see medical school is not all studying. There is some fun, and you do get to have some fun involved. But I originally went to medical school to pursue forensic pathology. So in undergrad, I had interned with the FBI. I had interned at the crime labs in Montgomery, Alabama, and so I was really interested in forensic pathology. And that's kind of what I wanted to do. When I went to medical school at UAB, University of Alabama, Birmingham, and between the first and second year, um, you are encouraged to do research at UAB. And so I did research out of the forensic pathology lab in Jefferson County. so I could get exposure to it. And I really didn't like it very much. I hated being in a lab all day. I hated not being around people, not seeing people, not interacting with people. And I was just like, I don't think I could really do this for the rest of my life. And so then I kind of wanted, pivoted, was kind of at a loss of what I wanted to do. So I was like, oh, well, I've always been, sports are great. Why don't I just pursue sports medicine? At the time, I really, orthopedics was the only thing I really knew of how to get into sports medicine with was orthopedic surgery. And I did my orthopedic rotation my third year and loved orthopedic clinic, hated the OR, couldn't stand it, hated being in the OR, found it boring. I thought it was monotonous. I just really despised being in the OR. And the surgeon that I was working with at the time, Dr. John Greco, who had trained at Miami and is a great sports medicine surgeon. Um, he was like, if you want to be an orthopedist, you have to love the OR. Like you can't not like the OR if you don't, if you and go into orthopedic surgery. He's like, I only go to clinic to find surgery cases. I hate clinic. And so, but then he introduced me to this whole field of primary sports medicine, which I had never heard of and didn't know anything about. And it just sounded great to me. Kind of doing orthopedic, clinic, taking care of patients, but then never really having to do surgery. And so I did. So I did my family medicine residency at in South Bend, Indiana, at St. Joseph Hospital. There, was lucky enough to get to work with Notre Dame during my residency, and then I did my sports medicine fellowship at Andrews Institute in Birmingham, Alabama, where I got to work with a lot of different colleges, namely the University of Alabama and the University of West Alabama. And then that led to my first job. So my first job, I was at in Livingston, Alabama, which is where the University of West Alabama is, which is a Division II school. It's a town of about 3,000 people, so it's very, very rural Alabama. So I had pursued a program when I knew I wanted to do primary sports. I pursued a program through UAB that kind of helped pay for my medical school if I committed to go to a rural part of Alabama for 4 years after fellowship. And so this satisfied that requirement. So I was a family doctor in town for the general population. I was the student health doctor for the university, and then I was the head team physician for the university. And so I took care of about 300 athletes there. Most of your normal sports, football, soccer, but uniquely for that area, UWA has a collegiate rodeo team. And so it was the first time that I had ever been exposed to rodeo, and we're going to talk a little bit about some of the unique challenges of rodeo and covering rodeo. But it was a great learning experience. It was incredibly humbling because I was by myself. Like I was out there, completely by myself. And so, you just learn how much you don't know. And so constantly trying to learn, constantly trying to get better. And so I was there for 4 years. And then I got the opportunity to go to Campbell Clinic in Memphis, Tennessee, which is the largest orthopedic practice in the state of Tennessee. And they cover pretty much every sports team in Tennessee and in Memphis. So I took care of the Grizzlies. I took care of the Hustle, which was the Grizzlies G League team. So I was the head team physician for the Hustle. I was an associate team physician for the Grizzlies. While we were there, Memphis 901 FC started, which is a USL team. So got to start that from the very beginning with them. And I covered University of Memphis, which is a Division I school, and then I also took care of Christian Brothers University, which is a Division II school while I was there. And then we also took care of the Redbirds, which are the division, which is the AAA affiliate of the St. Louis Cardinals. Um, and then when I had been there 2 years, the AAF, which was the American Alliance of Football, it was the precursor to the XFL and the USFL, had a Memphis team called the Memphis Express. I took care of them. So very, very busy. Um, Lots of experience, lots of great learning. Um, Not much in the way of social life when you're taking care of that many teams, or you're pretty much working a lot of hours, and I just didn't really feel that was sustainable for me. And then I got an opportunity to join Hospital for Special Surgery here in New York City, which Hospital for Special Surgery is the number one orthopedic hospital in the nation and has been for the last 10 plus years. It's one of the top places to do sports medicine. I felt very honored to be able to get the opportunity, so I took it. Um, I was lucky enough to cover when I first started. I was covering the XFL team. That was the Guardians, New York's Guardians. That didn't come back. They didn't make it through COVID, unfortunately. But that was a unique experience to cover football again. And then I got the opportunity to take care of the New York Liberty, which is the WNBA team here in New York. And I've been with them. This is my fifth season with them. Um, uh, Got to be part of of winning the WNBA championship. Um, got to take part in New York City's first basketball championship in 50 years. Now the Knicks have won, but that was a big deal then, and so they actually invited us to be part of the parade. And so that picture down at the bottom is our float, our HSS float. Um, and then doing all this, also maintaining, trying to be an athlete myself and continue lifelong athletics. In medical school, I started running, um, uh, and I've done 20 some odd half marathons and four full marathons. And this was my last full marathon that I just did 2 years ago was the St. Jude marathon in Memphis. And then a couple years ago, randomly decided to pick up rugby as a sport, and so have started playing recreational rugby for the last 2 years. Um, so kind of what sports have I covered? We went through some of these, but I think, obviously American football, you know, I covered it my entire life, and I've covered all the way from the high school level to the semi-professional level. Um, I covered University of Alabama, which some people would say is above semi-professional level. Even though it's college, it's pretty much professional level. And so, like football, high injury rates. You have a lot to do. There's always injuries. You're always doing stuff, and depending on what level you at, their stakes are very high. And I think the things that I learned from covering football were, one, being efficient. So, you know, you want to do a full exam and make sure you have confidence, but you can't spend 30 minutes doing a concussion eval. Like you've got, there's a time limit there, and you've got to get there. But also being very resolute in, that you need time to actually evaluate things. Like you need time um, to say, hey, this is going to take a little bit of time for me to determine exactly what's going on. Um, and sometimes you'll get some coaches that, are a little bit more difficult to deal with than others. And that's kind of part of um, part of the part of the job, and you learn how to do that. So when I was in Memphis, my main team at the University of Memphis was the women's soccer team there, who were very good. Um, Always top 15 in the nation. Either winners or runners up of the American Athletic Conference every year. Um, that lots. I had a lot of international players. So a lot of Canadian players and players from Europe, mainly England. And so it was they're used to a different type of healthcare system. And so managing that and navigating that was sometimes a little difficult. Not everything correlates exactly one to one. And so the main thing is that's very different is, especially in Europe, they have what they call physios, which are kind of like athletic trainers, but really not. They have they kind of have a much broader role than athletic trainers. They're kind of a little bit of physical therapy, a little bit of massage therapists, a little bit of athletic training as well. And so trying to make sure, trying to get some of the athletes to understand exactly what our athletic trainers did and didn't do was kind of a problem. I'm not a problem, but an interesting kind of thing. And then, you know, also dealing with people that are used to a universal healthcare system, and then you don't have that over here, and that they have to actually pay for their medicine and and things like that. And so it was very interesting. And then working with Memphis 901 FC, I remember when we first started and we met with their GM, and we were like, okay, well, what are the league requirements, for physicals? Like what do we need to do? Do we have to do EKGs? Do we have to do echoes? And they just were like, uh, we don't know. And so you go on like the USL website, like there's nothing. There's just, like there's really no requirements. The league hasn't set forth any kind of basic requirements. Um, and so I reached out to one of my mentors who put me in touch with Margot Patukian, who at the time was she was the medical director of MLS. And so I emailed her and just asked her, what does the MLS require of their teams for physicals? And she gave me kind of a list of what they did. And so I just went to our GMs and I'm like, this is what MLS is doing. This is what we should do. This is kind of the standard of care. Um, and they were okay with that. And so, we got all that set up. But a lot of more like administrative work. That was the first time that I really had to kind of set things up for myself, and kind of do a more administrative role. Um, but it was good. I enjoyed my time with them. I obviously being a soccer player myself, I enjoyed covering soccer and watching soccer. Um, and then rodeo. So collegiate rodeo was a very, very unique coverage experience. First of all, obviously rodeo is a high rate of injury sport, and typically their injuries can be very severe. But it also has a very big sports culture. So you are not allowed in the arena unless you have on cowboy boots and a cowboy hat. Those are things that are a requirement. And growing up at the beach, and even being from Alabama, I grew up on the beach. I did not have either of those things. I had never been to a rodeo in my life. So I had to go buy those things. And then, but, you know, the people there were so helpful, like kind of helping you learn, and I think that's where, we'll talk about some of the things that I've learned throughout my career. But no one expects you to know everything, like everybody comes from different experiences. And so it's okay to say, like, I'm not familiar with this, and I just said, I was like, I don't know anything about rodeo. Like, but there were athletic trainers that had been, with collegiate rodeo for 20 years. They've seen it all. And so they're there to help you. But it's very unique because it's and we'll kind of talk about this with pickleball too. It's a traveling sport. So like these athletes are gone, they're in West Alabama for rodeo this week, but they're in somewhere in Arkansas next week and Oklahoma next week. And so they're just constantly bouncing around. They don't really have like a home kind of medical clinic or anything like that. So I remember one of the years I covered, one of the bull riders got knocked off and the bull kind of stepped right on his shin. And he, developed obviously this big hematoma in his shin. We didn't think it was broken, but it was, swelling and it was bad. And then this guy was about to get in a car and drive 12 hours to Arkansas for the next. And all I could think is, his leg's going to swell and he's going to get compartment syndrome and he's going to be in the middle of nowhere. And, and so you have all these unique kind of challenges or, like that. I had an athlete with a concussion. Um, and then you're like, who's going to follow up on this? Like, who's going to, first of all, who's going to make sure he doesn't compete next week? Who's going to do all this? And so trying to navigate some of that was quite unique. I started taking care of pickleball, Major League Pickleball, which if you didn't know, that's the professional pickleball circuit that's on one of them. PPA is the other one. But we HSS we cover, so I cover two or three of their events a year, mostly like overuse injuries. But again, these are athletes that, they just go from one event to another. Like they may be in Florida one week, California the next. They're just all over the country competing. Um, and so it's, sometimes hard to get like arrange follow up for them, arrange testing because there's just like not really any continuity there. Uh, Running, obviously, as a runner myself, I deal with a lot of runners that come into my office because they know I'm a runner. And so, running is mostly going to be overuse injuries, stress fractures, overuse kind of things. Um, but with running, especially marathons and things like that, you have cardiac arrests, you have heat illness, you have very, very big emergencies. So while most of the things you take care of are fairly benign, you definitely have some very serious things that you have to be prepared for when you're covering um, baseball. So training at Andrews Sports Medicine, which is obviously like probably one of the premier baseball sports medicine clinics in the nation. So I was exposed to a lot of treating overhead athletes, UCLs, pitcher arms. So, you know, that always, you want where you do your training. Some people say where you do your training doesn't matter, but it really, really does. Because once people like, so even here in New York, people know Andrew Sports Medicine. So when they see that in my profile, I mean, I have a huge baseball practice because they know that name. And so I have a lot of baseball players. I have baseball players that come from Connecticut, Pennsylvania, Maryland to come see me because they know the Andrews name. So where you do your training, each place kind of has their niche. There's a lot of places that have their niche or their certain things that they do. And so you will be kind of known for that. So if it's not something that you're really interested in, you really kind of need to think twice about that because that's something that, you will become your niche as well. And then if anybody had ever told me when I first started that I would be a basketball team physician, I would have told them they were crazy. Probably out of all the major sports, basketball is like one of my least favorite. Uh, and so, but it just so happened in Memphis, I worked in Memphis, you get set up with the Grizzlies and they ask you to do it and you say yes. And so then like that, when HSS was looking for somebody, so my office is in Brooklyn and it's at the Nets training facility. So they were looking for somebody with NBA experience to run that clinic to be able to take care of the NBA players when they needed it. Um, well, that's pretty unique. There's not a lot of people out there with NBA experience. So that's kind of one of the reasons I got my job at HSS is because I had that experience. And then when the opportunity came to take care of the Liberty, um, I already knew how much I liked taking care of female athletes from working with, University of Memphis women's soccer. I will tell you, in my experience, women athletes are 10 times easier to work with than male athletes. They work harder, they are tougher, and every single way, shape, and form. I love working with a women's team. They're great. They're great people. I love working with the Liberty. It has been one of the biggest joys of my career. Um, I love working with them. But there's a lot of challenges that come with the WNBA. They have a long season in and of themselves with the W. It's 40 games. So they're playing 2 or 3 games a week. every single week. But then they don't really have most of these athletes don't really have an off season. So they go straight from the WNBA to go play overseas or to play in the new domestic leagues here in the United States. So they, unlike the NBA, which is again a big season, 82 games, but then for the 3 months that they're off, the NBA players rest or they condition, they don't completely rest, but they're not playing competitive basketball. Most of the women are playing competitive basketball year round. And so you get a lot of load management issues trying to work through those. And it's sometimes really challenging to figure out. And sometimes you have to have those hard conversations with the coach, like be like, look, she can probably give you one game this week. She can't give you three. So which game do you want her for? And those are conversations that you have to have. And you have to learn how to work those out. And then, like I said, 2 years ago, kind of really got exposed to rugby for the first time in my career. When I first moved here, we HSS took care of RUNY, which was Rugby Union of New York. And I was going to help out with that. And then, of course, COVID happened, and that kind of, that team unfortunately folded. But I got really exposed to rugby at that time because I didn't know a whole lot about it. Became very interested in it. Um, so, lucky with Vic was got to and Liliana was got to cover the New York Sevens tournament here in New York this past year, which was great. Um, if you want to see a lot of injuries, come watch people play sevens rugby for days at a time. Like it's a lot of high injury rate, a lot of good exposure to things. But then also being a player, obviously my whole team knows that I'm a physician, but then that word gets around, outside the tournament. So when you're at a tournament, it gets around that there's a sports medicine physician that is also playing. And so, I'll have people that come up and start asking me questions and things like that. And I'm like, I'm trying to warm up here for my game. But yeah, always, like that's the thing when if you do decide to pursue sports medicine or become a physician, you know, it's a it's not just a career, it's a life. I mean, because you will always be a doctor. It doesn't matter where you are, you will always be a physician. So if you're on a plane, you're a physician. If you're, at a resort on vacation and somebody collapses in front of you, you're a physician. Like so you're always, you're not always on call, but you're always available to take care of people because that's what you chose to do. Like that's the calling. That's what we chose to do. And so you kind of have to be that for people. And so I have no, I love trying to help people out and try to get them into the right spot. Luckily I've worked with a lot of different people throughout my career, so I can, kind of help them find people even if they don't live in New York, which is good. Um, but like, so kind of pivoting a little bit, and talking about like college athletics. So, college athletics, you are great because you have a big team. Like you have a big team that you work with. You've got athletic trainers, you've got strength and conditioning coaches, nutritionists, team psychologists. You've got a lot of different resources at your disposal, and especially at the bigger levels like D1. At D2, D3, you don't have as many of those resources. And, you're having to try to find those and ship those out. And so, probably the biggest thing about taking care of college is you have to be a good communicator. Like you have to be able to communicate with people. Like you have a lot of different people you're working with, and you've got to be able to communicate with them. You got to communicate with parents, sometimes unreasonable parents, that aren't right there with their child for the first time in their life. So they can have, those can kind of have other issues. But yeah, you got to be able to talk to people, effectively and delegate, you don't have to do everything because you do have um, other people at your disposal. And then working with professional levels. So, everybody thinks that, oh, professional, everybody wants to do profession, take care of a professional team. That's the ultimate goal. It's not for everybody. because it is a very, very high stake environment. The pressures are very, very high. It is very much about the results on the court, on the field, and not that we don't they don't care about the athlete's health, but because they do, but it's about winning. I mean, that's professional sports is about winning. That's what it's about. And so you're trying to get your players as healthy as you can keep them so that they can do their job, because that's what it is. It's their job. And so, there's a lot of attention on you. You've the lots of eyes, lots of people that are making comments about the way you treat people, or the way, this athlete, was treated or not treated well. And so, it's something that you have to have a real thick skin. Like, I don't really get on the Liberty blog pages or the social media plays, because I don't want to see what the fans are saying, but because, there are team physicians that, they get attacked on social media and things like, so it happens. And so you have to be very, kind of have a thick skin. And then the other thing is, it's a very high stake litigation. So, if you make a mistake, you're talking about a multi-million-dollar athlete that you made a mistake on. And if they decide that they want to sue you, then that's a big lawsuit. And obviously, you know, physicians get paid well. They don't get paid like professional basketball players. So, they're what they want in compensation is nowhere near what your compensation is. And so it's a very, very high stakes environment. And again, that's where communication is so important. Talking, documentation becomes hugely important, and making sure you're documenting what you're doing and why you're doing it. So and then working at hospital for special surgery, I mean, I feel so lucky to be here. It has allowed me to work with like some of the best in the field. I've learned so much here, and got to be on the cutting edge of so much, anything that's kind of coming out, HSS kind of has their hands in it, and they kind of know about it. And so it's just been great. And then like that, getting to work with amazing athletes that I never would have had the chance to work with without being here. So um, I think they wanted me to talk a little bit about some meaningful cases. And so I chose a few. My favorite cases are always the ones that have a good outcome. I think for most people, you always want your best cases to be the players that got back, that won, like that, winning the championship, the WNBA championship. When I was at West Alabama, they, won their conference multiple times. Like being part of that winning culture and winning environment is great. But the ones that usually stick out are the ones that kind of maybe didn't go as well, or maybe you would like looking back, you would do things a little bit differently. So when I was at West Alabama, we had a collegiate baseball player that came in with rib pain. So he's a pitcher, came in with rib pain. Um, Very non-specific, kind of hurt when he threw, hurt when he lifted, you know, just kind of right on his side here. We treated him for an oblique strain. Um, just kind of, pretty common with baseball pitchers to get intercostal irritation or an oblique strain. So he's working with our athletic trainer. And I kind of lost track of him. He didn't, I wasn't seeing him. He was seeing mostly the athletic trainer, wasn't really seeing him very much. And then he came into my office, like my actual office at Student Health. Um, and he's like, Doc, I just don't really feel good. I've got fever. Like, I just feel really tired all the time. Um, and so, I was listening to his lungs, and I was like, this doesn't, there's really not a lot of breath sounds on this side of his chest. And so ended up getting a chest x-ray. He had a huge tumor in his chest, like a big, big tumor. Um, Ended up being a Ewing sarcoma. And so we sent him up to St. Jude to Memphis. Um, where he had it resected, underwent chemo. He's doing well, in complete remission. Um, but it's one of those things, looking back on it now, I wish I kind of had kept a little bit better track of him. And, like, was he getting better? Again, about communication, like, hey, how's he doing? Is he making improvements? Is he still having pain? If he's still having pain, maybe we should get some more imaging. Maybe we should do some more look into it. And it's tough because we all know, I mean, if you're in sports medicine for any length of time, oblique strains take forever. They can take 6 months, a year to kind of, so it's not uncommon for them to just kind of linger. And so sometimes you get into that um, pigeonhole where you're like, yeah, these just take a while instead of kind of taking a step back. Um, Another challenging case I had was I had a professional basketball player. So they were playing away. She was running around and got hit with a blindsided screen, didn't really see it, fell to the ground. She was evaluated by the team physician for that team because we don't travel with the WNBA. The home team physician is the one that covers the court. So they evaluated her, thought everything looked okay. They didn't really think she had any signs of a concussion. Um, but our athletic trainer just really wasn't comfortable with her going back in the game. And I was like, fine, just keep her out for this game. They were flying home that night. I was like, I'll see her first thing in the morning. Um, so they did. I saw her first thing in the morning, did a full concussion eval. No, she denied any symptoms, denied any trouble, any problems. She passed all of her testing, flying colors, passed all of her testing. Um, we had a game 2 days later. She went into the game, didn't take a hit or anything, but just came off the court saying that her head hurt, that she didn't feel good, um, that she was nauseous. She felt like she was going to, throw up. So we took her back to the locker room. And this is where concussion gets very complicated. So there had been a GI bug going around the team. So it was like, does she have, the stomach virus that's going around? They had also the entire like they had all just gotten their COVID when they returned from this trip. They all had gotten their COVID booster. So she had gotten her COVID booster like 2 days before. So it was like, is she feeling bad from you know, the the vaccine? It was kind of like, well, it's probably not a concussion because concussion symptoms don't present 48 hours later. Like that's just not the way concussions present. And so but she just, so we were just kind of, obviously held her out for precautionary purposes, but we were kind of treating it like it was, kind of a viral kind of illness kind of thing. But then a couple days, she still wasn't doing well. And then come to find out, so she had been having concussion symptoms ever since she got hit. She had been having headaches. She had been having dizziness. She just didn't disclose any of it to any of us, but she had been disclosing it to the other players. Like, so she had been telling the other players that she wasn't feeling good, that she had a headache, that she felt off. But none of them came like to the sports medicine staff. And so again, it's like, it's all about communication, like, we have to look out for each other. We have to look out for um, our teammates. And so, it was just one of those things, and again, we, we look bad. I look bad because, we put her in concussion protocol 4 days after, she has got the hit. So that looks bad. But in the same way, she wasn't playing. We were holding her out. So there wasn't any danger. But again, it's not a great look. We caught some slack with it from the league. You catch slack with it all over the media and stuff. But, it is what it is. And again, that's kind of where you have to have a thick skin. You have to learn. And then like that, like this was a newer player to our team. I didn't have, I didn't know her as well, didn't have that same rapport with her that I had with some of the other team that had been on the team longer. And so I think, again, that's where, you got to come in and, you have to make an effort to kind of get to know people. And just a funny story. So when I was at West Alabama, I got approached by a community college that's in East Mississippi. Some of you may know it if you've ever watched the show Last Chance U. So this is a community college where the SEC sends a lot of their non-qualifiers. So recruits that can't make the minimum GPA or ACT score to get into college, they send them to this school to get their associate's degree so that then they can qualify for SEC football. And so I was approached by their athletic trainer if I could be a concussion consultant for them because they had an orthopedic surgeon that covered them, but they didn't have anyone that did their concussions. And the very first day, I go over there, meet with the coaching staff, and the coach looks at me and goes, "Oh, I don't believe in concussions." And I was like, "Oh, this is going to be a great year." This is, so sometimes you have those challenging coaches. We butted heads all year long. And it was one of those things I finally just kind of had to put my foot down and be like, well, this is the way it is. I don't care if you agree with it or not. This is the way it's going to be. Like they're out, they have a concussion. And so I think, there's definitely times where you want to, you know, communicate in a way where you're trying to educate and trying to be helpful. But sometimes, you get to that point where you're like, no, I am the physician and this is what I say and this is what we're doing. So you kind of have those. Um, so kind of my advice for people kind of coming up as young professionals. So you be confident, but don't be cocky. No one likes someone who thinks they know everything, but be confident in what you do know. And that goes for every aspect of your career. Like when I'm with an athlete, I have to exude confidence. That athlete has to have confidence that I know what I'm talking about, and so that they can believe me. And so if you don't exude that confidence, then you're not going to be a good physician because your patients aren't going to be able to trust you. And so, but you don't want to be so cocky that you think you know everything because nobody knows everything. I'm still learning. I've been in practice for 15 years and I'm still learning every day. Um, that going along, be humble and always willing to learn, you know, new sports, every sport kind of has its different rule and you're not going to be familiar with every single sport. Like I, when I was at West Alabama, our tennis coach called me and he was screaming and cussing because our athletic trainer, one of our athletes had like twisted her ankle and the athletic trainer just ran on the court. In tennis, that's a default. Like if the ref doesn't call a medical timeout and somebody touches the athlete, that's a default. And so, but again, the athletic trainer didn't know. They didn't know the rules. They were just trying to help. But again, if you're going to cover a sport, got to learn the rules, got to know what it is. Like rugby is very unique in the fact that you don't wait for a stoppage. It's the only sport that I really know of that you don't wait as for a stoppage of play as a medical professional to run on the field and treat an athlete. Like you're still treating an athlete while they're still playing. You do that in soccer, it's a yellow card. So, it's learning the ins and outs of all the sports. And if you don't know, like that, ask your coaches, ask the people around you, ask the athletic trainers who've been covering that sport for a while. Um, you know, Always be invested in your athletes. I think it's hugely important, but don't be a fan. We all want to succeed together. We all want to win, but don't let it carry over to where you're a fanboy, fangirl, like asking players for autographs, no, asking players for pictures. No, that's just not, it's not professional. It's not, you're their doctor. Like now if they offer, like I've had athletes that are like, "Hey doc, could you mind if I put this on social media?" And I'm like, "Fine." If they offer, it's fine, but don't, or like sometimes at the end of season, like we'll, for example, while I was at West Alabama, one of the athletes I took care of was Malcolm Butler. So Malcolm Butler was a cornerback for us when I was at West Alabama, who went on to play for the Patriots and make the game-winning interception in the Super Bowl. And so the next year he came back to West Alabama, and so I reached out to his agent, and I was like, if I gave you Malcolm's Patriots jersey, do you think he'd be willing to sign it? And he said yes, and and I got it hanging in my office now, and so it's a great memento and things like that. But that like that there's a way to go through that. You go through, you don't ask the athlete themselves. You go through the agent, just like, you go through the agent and, ask for it. But the biggest advice that I can give is you always have to care for yourself so you can care for others. You cannot care for people if you're not taking care of yourself. And I talked about my time at Memphis, which was great, but I was working a lot, working really long hours, and it was taking a big toll on me personally, and that was affecting how I cared for people. And so you have to be aware of that, and you have to be able to take care of yourself first, or you're just not going to be able to effectively take care of people. Okay, so I think that's enough talking for me. Sorry, I think that went longer than we really want. I really wanted to, but
Thank you, Dr. Robinson, for your excellent presentation. It's really useful to hear your personal experiences in sports medicine. I think it provides us a lot of perspective. Before we start the Q&A, could we get a group picture with Dr. Robinson? I'll count us down. 3, 2, 1. Okay, thank you. Now, again, excellent presentation. Does anybody have any questions for Dr. Robinson or Dr. Lopez? Do you have anything to say?
I'll start.
Yeah.
Yeah, thank you. Hi, Dr. Robinson. Thank you for the wonderful presentation. I was wondering, as someone who's like still choosing their career later on to like their academic uh, life, and obviously like medical careers are very demanding. Even after like med school, you said you were working long hours and stuff like that. Were there any factors that pushed you onto the path of being a physician? And do you have any tips for someone who might be choosing their career while still in college or while still pursuing their studies?
yeah, I mean, I think I mean, to me, that's a great thing about sports medicine is there's so many ways to be involved in sports medicine. So you can be an athletic trainer, you can be a physical therapist, you can be a sports nutritionist, you can be strength and conditioning coach, you can be a physician, you can be a non-surgical physician, you can be a surgical physician. There's just so many different avenues. So you kind of have to find like again what you love to do because this is something that you're going to have to do every day for pretty much the rest of your life. And so um you know for me, I if you asked me when I was 5 years old, I said I wanted to be a doctor, and that's always what I said I wanted to do is I want to be a doctor, I want to be a doctor. But I think it's really important that you do like shadow, like you kind of shadow physicians, find out, is this something you really want to do? Because you don't want to get into like your third or fourth year of medical school when you're doing your clinicals and realize, I don't really like this. And I had I had, colleagues that were in my medical school class that dropped out of medical school their third year because they realized that wasn't what they wanted to do with their life. And, I think like that's where you kind of interact with people, see people, like listen to people's presentation. Good thing is, one of the things that y'all have an advantage of is there are so many people that kind of put their careers and stuff out on social media. So like that, following doctors, like following sports medicine doctors, following physical therapists, following athletic trainers. So you can kind of and from their social media you can kind of see a little bit of what their job's like. You get a little insight into what they do on a daily basis. And so it kind of gives you some insight. The other thing is don't don't be scared to change. You know? Like if, I mean, I would say most of my class, what they thought their specialty was going to be when they went into medical school was not what they ended up doing. So again, being open-minded and, like because you don't know, you really don't know what it's like. Like, I had worked with the FBI and, watched, CSI and then I was like, oh, forensics is so cool. And then what I realized is, most of it is doing autopsies on 70-year-old person dies at home alone, and you're like, okay, is it a stroke or a heart attack? It's not this every case is a murder case that you're going, it's not that exciting kind of thing that you hear about. And so like what you may have an impression of may not really be what the field is like, and so you have to be open-minded to change it.
Thank you.
Hunter?
Hi, Dr. Robertson. Thank you so much for that. I think it's really helpful for all of us because, as you know, we're all kind of looking into sports medicine. I have two questions for you. The first is, what is the skill that you kind of talked a lot about communication and kind of confidence and being exposed to a lot of different sports. What is the most important skill outside of that that you use the most often and you think is the most beneficial for medical personnel?
I think for me, being able to multitask is probably the best skill that I have. I'm a very good multitasker. I'm very, very good at it. And so it helps me get through clinic like in a day, and I can see a lot of patients in a day and get done with clinic on time, and my notes are done and things like that. But that's not a skill everybody has to have. But I think, I really do. If there's one skill that you need as a physician, it is the ability to talk to people. Your job is to talk to people. That's what it is. Like, some days I'll call my sister after, work, and, she'll complain about something. I'll be like, look, I've had a really long day of listening to people complain all the time. Can we just not complain about things right now? So, because that's really, I mean, that people are hurting, they're in your office because they're hurting or they're sick, or, so you have to be able to communicate with them. And that's where I think, I was very lucky that, like, I went to a liberal arts school for undergrad, so I had to take a lot of humanities classes. I did drama. I took a lot, so, like, I have a very I can talk to people about a lot of different things, and that develops, a good rapport with patients when you can latch on to something that they're also interested in, and you can be like, yeah, like, we can talk about that. And so I think that, it's not all about like the science, it's about being a well-rounded person. So you're able to kind of communicate and talk with people. Because I mean, I have some people that I went to medical school with that were extremely intelligent and, aced every test, every class, were the top of their class, but they're not great doctors. They know everything, but they're just not good at communicating with people, and they don't get the right information because they don't know how to communicate. Because that's most of what being in medicine is about, is getting the right information out of the patient so that then you can help make the diagnosis.
Thank you. And then my second question is, because we're all kind of getting to the point where we're applying for med school or we're like myself, we're applying for colleges. What did you do in school that set you up to be so successful? What did you do to get you all these opportunities at with like the Grizzlies, with Liberty, to be able to go to HSS?
Yeah, I think one of the things is, early in the career, you have to be a yes person. you know like, it may not be the opportunity that you want, or that your ultimate goal is, but if you say no to things, then people aren't going to come to you with opportunities. And so, very much like that, like, I would have never considered myself a basketball position. That was, if you had asked me like what sport I would most like to cover, basketball wasn't it. But when they were like, hey, we need somebody to cover the G League team, I was like, yes, yes, I'll do it. Because that was an opportunity. That was a step up from, college. It was an opportunity. It's like, okay, I'm going to get to cover a professional team. It's going to be my team. Um, and then like that's just snowballed into other opportunities and other things like that. I never would have gotten the job at HSS without that opportunity, because I never would have had that experience that they were looking for. So I think, yeah, you got to be a yes person, because you never know. Now I love taking care of basketball. Love it. I love the Liberty games. I have a blast. I absolutely love it. So you never know what you're going to like and what you're not going to like until you actually get to do it. Um, and so, because some of the sports that I like to watch the most, I don't really like to cover that much. Like it doesn't always, it doesn't always equate to your favorite sport is also like what you like to cover. Like I love baseball. I love seeing baseball athletes in clinic. I would be bored out of my mind if I took care of a professional baseball team. Like I would be bored out of my mind watching 3.5 hours of baseball 3 days a week every day. It does, so it's like everybody's unique, but like one of my good friends and colleagues who's the team physician for the Mets absolutely loves it. Like so it's all like what you like and what you like to do, and everybody's gonna kind of have their unique skill set of like what they like.
Thank you so much. I feel like your presentation really resonated with me, so thank you.
I'd like to also ask a question. For you, what you mentioned that you originally wanted to be a forensic pathologist. What was your original motivation behind that?
So I don't know if any of you are familiar with an author called Patricia Cornwell, but she is an author and she writes crime novels about a forensic pathologist, Kay Scarpetta. Nicole Kid, they just turned it into a mini series with Nicole Kidman starring in it. I have read every single one of her books and absolutely loved them. And so when I was in high school, and I was reading all these books, I was like, oh, I want to be a forensic pathologist. Like this sounds cool. Like this sounds awesome. And then these are fiction. I mean, there's a lot of like, she does a good job of doing a lot of research and stuff and making them realistic, but they're still fiction. And so, yeah, that's kind of what I wanted to do. And so then I got the opportunity to intern with the FBI, and I worked in their crime labs. I worked in the crime labs in Montgomery, and like that, I was a chemistry major. Like I was a cell biology chemistry major. So, like I was used to being in a lab, you know, doing analysis and things like that. Um, but then just like, you change. I mean, that's the other thing too. It's not just, I mean, your interests are going to change as you grow, and, and as you kind of mature and become an adult, you know, what you what you like at some point is not going to be the same. Like that, if you had ever told me that I'd be living in New York City and absolutely love it, I would have told you were beyond crazy. I mean, I grew up at a beach town in Alabama. Like, I never would have said that I would have ever been in New York City. And I absolutely love it. So it's just, you never know. And so that's again saying yes to opportunities, because you never know what's going to stick and what you're really going to like, and what you're really going to find the passion for. And and so it's great, like to do these kind of things where you get involved in research, you kind of see, like see what that is like. So me, research is not my favorite thing in the world. Like, I don't really like doing a lot of research. I much rather see patients in clinic. Like that's just me. I like my clinical work. Other people, like we just had one of our, joint surgeons that left to pursue a purely research career. He's not even going to treat patients anymore. All he's going to do is research. So, everybody has their unique interest.
Thank
And so
you.
that's why at your stage, like when you're at the high school undergrad level, say yes to everything. Try everything, because you do not know, you never know what may end up being the thing that you are most passionate about until you are exposed to it.
Thank you. Isabella?
Hi, Dr. Robinson. Wow, I think your story is super inspiring, and I think all the activities you've done are super impressive. So it makes me curious. Your schedule, your work-life balance, it must be super demanding. So for us to be successful pre-med and physicians later in life, I'm curious. what boundaries did you have to set early in your career to maintain this healthy work-life balance?
Yeah, I think if you would ask me early in my career, I wasn't good at it. Like I was not good at it. In undergrad, I was terrible at it. I was actually so terrible at it that one of my faculty advisors pulled me into her office and was like, "I'm going to ask you to do something, and you have to say no." And she was like, "We're going to practice this because you need to start telling people no." Because I would not. I would, anybody that wanted anything, I would say yes. I would overextend myself, and you're right. You have to learn how to create those back because I didn't want to disappoint people, um, and, and you have to learn how to create those boundaries where you say, this is not healthy for me, and this is not sustainable. So luckily, my job now, you know, any kind of physician practice, you're going to have your like 8 to 5 private practice kind of job. Like you're in clinic, you're seeing patients, so I've got that. But, the Liberty season starts, end of April to October. It's a pretty short season. So yeah, am I really busy during that time? Yes. But then I'm not so busy during the winter. And so I go on vacation and I go and do stuff, so you find those times when you're not as busy to kind of have that like work-life balance. And then luckily the last couple years, I have a colleague that I'm splitting the Liberty with. So, like, because it was getting to where it was like, gosh, every summer, like I can never take vacation during the summer. Like my entire summer is, spent covering basketball. And so, so that we can, so like that, my rugby team, we're going to Australia in August. Never would have been able to do that unless I had a colleague that could cover while I was gone. And so I think that those are things that you learn. You learn how to get help because nobody can do it alone, you know, and then you learn to set those boundaries. Whereas, like for some people, like having that work-life balance, family, very important. And so they may choose a specialty where the hours and the demands are not as much. There are medical specialties out there where you work a shift. You work your shift, you're done. Like like ER, you work your 3 10-hour shifts a week and you're done. And you're off the other 4 days. So it's, like, or you have like a more outpatient kind of practice like dermatology or, where you're pretty much just in your clinic but there's no call or after hour kind of commitment kind of thing. So there are those specialties out there. And so you can learn those. I tell people all the time, I love my athletic trainers. They are my favorite people to work with. They are the hardest working people in the world. I mean, they work incredible hours. They work so hard. I could never be an athletic trainer. Could never do it. I couldn't do it. So that's a special kind of person, that is able to do that. And so you have to know that. And like that, they love what they do. And if you talk to most of them, they absolutely love their job and they wouldn't do anything else. But it's a lot of work.
All right. Thank you so much, Dr. Robinson. That was very informative.
And I think that's the thing is it's about loving what you do. So, like when I'm at the Liberty, when I cover, that's not work. I mean, I don't consider that work. That's fun. I have fun. The games are fun. I love the team. I love being around the team. Like when, like that, when I got to cover the sevens tournament, that's not work to me. Like that's fun. Like I'd probably be out there watching rugby all day anyway. So whether I was working or not, so that's fun to me. And so you have to find those, and that's where, like, for me, that's why the pull was to sports medicine, because I do love sports so much. I love sport. I am always watching sports. And my family makes fun of me because I'll watch any kind of sport. When the Olympics is on, I'm watching everything, every sport I'm watching, because I want to learn. So again, that's fun. I just don't really feel like that's work, and that's what you have to find. You have to find something you're passionate about that doesn't make you feel like it's work.
Gotcha. Thank you.
Jordan?
Hi, Dr. Robinson. Thank you so much for your fascinating presentation. My question was, you touched a little bit on working with a women's team, and I was wondering if, and I know the rules for women's teams in a lot of different sports differ from the rules of a men's team, and I was wondering if that impacted any of the injuries you've seen, if there are more injuries on some area or less injuries, and just how that's kind of influenced, how the rules have influenced how, at least how you have seen the game.
Yeah, and that's a great question. And yes, we know that I mean, from research, we know that there are differences between female athletes and male athletes. So, we know that female athletes are more prone to ACL injuries. They are more prone to concussions. And when you compare sports that have like soccer, women's soccer, men's soccer rules are pretty much the same. You can make a lot of differences about the way they're ref. We can talk about that. But they're similar sports, and when you compare them apples to apples, female athletes have more concussions, have more ACL injuries. Now, is that a biological difference that female athletes have, or is that a training difference? Do we train females athletes differently, especially at a young age? And I would argue that we do. And if you look at the data, I would argue that at a young age, when young girls are coming up playing sports, much less emphasis on strength training than there are for their boy counterparts, much more emphasis on functional movement. There unfortunately still is a lot of misogyny when it comes to women's sports. And I mean, I remember when I was at Memphis, shouldn't probably been doing this at that as a the doctor, but I was giving the ref a really hard time because he missed what I felt was an obvious red card. And literally after the game, he came to me and said, well, you can't really expect women athletes to control their bodies that way. And I was like, wow, you should probably not be reffing women's sports or anywhere around. But there is that misogyny that, women athletes are not as athletic, are not as good. And so, like that, women's basketball is a perfect example. Take the way the NBA is reffed versus the way the WNBA is reffed. And what is allowed in the WNBA would never be allowed in the NBA. And why is that? Why are we letting the women play so rough? Like, why are we letting them foul and grab? And again, like, I would argue that some of that is a little bit of misogyny, that we think that female athletes can't do it. And I can tell you, being around working with female athletes for years, they can do anything you ask them to do. Absolutely. You just have to give them the proper training and expect the same things out of them, and they can do anything that you ask them to do. So I think that it's a great question that we have to learn, because when you compare at the elite level, like, the injury risk is similar. So like when you compare elite women's soccer players to elite male soccer players, they don't have that gap really narrows. And so I think a lot of it has to go with training and how we train. And hopefully that's changing. I think there is a new emphasis on strength training in young girls. As we know, it's so important for bone health as women mature. And so I think that that's a huge thing that is going to come up, that we're encouraging young girls and young women to strength train. And I think I think it's going to be a game changer when it comes to injury prevention.
Thank you. I mean, coming from an all-girls school, that's all very insightful information to hear. So thank you.
Well, and it's just like, I mean, again, like, take the WNBA 10 years ago. Like, before I started with the Liberty, the season before I started with them, they were playing in Westchester County in a community center that held like 6,000 people. They did not have a locker room that was theirs. They definitely didn't have a training room or a weight room. The athletic trainer was carrying around all the equipment in the back of her car because they would practice at one gym, compete at another. What NBA team would that ever happen at? Never. So, like this is something that in the last, I mean, this is in the last 6 or 7 years where, where we're changing. And, now with the Liberty, we have, three strength and conditioning coaches. We have two athletic trainers. We have two PTs. They have their own locker room. They're getting a brand new training facility that's going to be just there. I mean, they're now getting the resources that a professional athlete deserves, but they're just now getting that. And the league, this is the 30th year of the league.
Right.
Hi, Dr. Robinson. Thank you for an amazing and insightful presentation. I just have a question on like new athletes, especially with the Liberty and draft and like free agents and having new athletes come in every season. I'm just wondering, how do you build the trust with them, especially with them coming to a new team?
Yeah, it's tough. It's tough. Like, so one of the things is physical. So that's the good. You get to do a physical with the athlete when they first come in. And so if I know, like, where like one of our established athletes that I've known for years and years, I may kind of like, hey, how was your off season? How was Turkey or Spain or wherever they were playing in the off season? But with the new athletes, I really try to have like you know a lot more personal conversations about like where are you from, just to try to find some kind of common ground where then you can kind of develop that rapport. And I think one of the things that at the professional level we do, like all of my athletes have my cell phone number, and I encourage them to use it. Like, I'm just like, if you need anything, call me, text me, doesn't matter, time of day, doesn't matter, whatever you need. And I think that helps to go along that, like, look, I'm here for you. I'm here to help you. I'm here for whatever you need. Um, and then like that, again, like I said, you don't want to be a fan, but being actively involved is important, because if you're like the doctor that's just kind of sitting there not paying attention, like the athletes see that, they see it, and so they, my athletes know that, like, I'm cheering for them. I'm there. I'll yell at the refs for them, to protect them. Like I'm there. um but you can't take it overboard, but like, you know it's just kind of one of those things. Like, and I had like one of our athletes who got traded to another team. And I recently, they came back and played, and I saw her, and, she was saying, I was like asking her how it was going. And she's like, you know, it's just not the same. She's like, we have a different doctor like every night. I don't really trust them. I don't really know them. When they're there, they seem like they're completely disinterested. They're not even watching the game. You're always cheering, and I've always got on my seafoam, or like, um and so I think it's those little things that athletes were, notice. So, for example, like, you know, when I first started with the Liberty, you know, and then we traded and got Brianna, got Stewie, you know, one of, I've always kind of, I like to support my athletes. So I went out and bought her Pumas, and wore them to a game. She noticed, she was like, great shoes, Doc. I really love those shoes. But those are kind of little things that they notice. Like, you're invested in them. You want to see them succeed.
Thank you.
Chris?
Hi, Dr. Robinson. Amazing presentation. It was very informative. My question kind of relates a little more to when you see and treat elite athletes versus your normal or regular athletes that you see. Elite athletes really want to get back on the court, on the field. It's their livelihood. How do you deal with that mindset, say, if two elite athletes and a recreational athlete have the same injury?
Yeah. That's a great question. The textbook answer would say we don't treat them any differently. You know, like that's what HSS would tell you is we treat everybody like an elite athlete, professional athlete. We all know that that's not really, 100% true. But I do think it is important to understand, like, for example, like I had a patient, who was a recreational soccer player who has, he strained his popliteus, had a hematoma. He's like, look, I have a huge soccer tournament that only happens every 4 years. I've been preparing for this for 4 years. This will be my last one. If there's any way you can get me back on the field, I would love to be able to play. And then I have time to rest. And so like that, you obviously talk about the risk and, things with them, but like that's something that's really important to him. And no, it's not a WNBA championship game, but this is something that is equally important to this person. And so you, as a physician, you have to understand that and you have to empathize with that. And I think that's where, like, being an athlete myself, I get it, like that. I've got a tournament coming up in Australia that I've been preparing for 2 years. If I sprain my ankle, I'm going to one of my colleagues and I'm like, I don't care, shoot me up, make make this better so I can play. I do not care. And you have to have, like you have to understand that mentality. Now, sometimes we have to, at the elite level, be like, no, like this is not what's good for you long term. This is going to be detrimental to you long term. And sometimes we have to be the gatekeepers and protect the athlete from themselves. So there was a study that was done. This was done back in the like mid 90s, where it was an anonymous survey where they surveyed Olympic level athletes. And they asked them, if you could take a substance that would guarantee that you would win your sport, but was completely undetectable, would you take it? And like 90% of them said yes. The follow-up question was, in 5 years, this same substance would kill you. Would you still take it? 70% still said yes. Like, that's the mindset that you have to get into of an elite athlete. Like, these people, it's a different mentality. Like elite athletes are not normal people. They are not like you or I. They have a different drive, that is why they are elite. Now, some of it's just genetics, but some of it is just their drive and they have a different mindset. And so sometimes we have to protect them from themselves. But for example, like let's say we talk about a hamstring strain. Okay. So if one of my Liberty players gets a hamstring strain, obviously they're getting an MRI. We're getting an MRI that day, the next day. If I have a recreational athlete that gets a hamstring strain, I don't necessarily order an MRI because it's not really going to change what I do or manage, and even at the elite level, it doesn't really change how I manage it. The difference is that I can maybe give the coaching staff a little bit better timeline with an MRI, which is important at that level, not so much in a recreational. If it's going to take 3 months, 6 weeks to heal, 3 months to heal, I mean, it's going to take time to heal. It is what it is. It's going to take time. And so, those are some things that you kind of look at as kind of differences. And then also, like, you have to understand, like, the monetary concerns. An MRI is not free. And, if you're talking about the Liberty, they don't care. Like, they pay for it. If you're talking about a person that, like maybe a blue collar worker living paycheck to paycheck, that $1,000 deductible that they have to pay for their MRI, that may be a big deal to them. And if it's not completely necessary, why are you doing it? And so I have a lot of those conversations with my patients. We talk about like PRP, great. I love PRP. I think it's great. Not covered by insurance. And at HSS we charge $1,000. That ain't cheap, and that's out of some people's reach. So, it's one of those things that, and that's what I always preface it when I'm talking to my patients. I'm like, you got to understand when I take care of the Liberty, money is not a factor. We throw everything at them. Like they get PRP, they get HA, they get everything because we don't worry about money. But that's not the same. We have to worry, we as normal, people, we have to worry about money and those kind of things. And unfortunately, that's part of our healthcare system.
Very interesting. Thank you very much.
Natalia?
Hi, Dr. Robinson. Thank you so much for sharing your journey and how you came to where you are now. I'm on the rowing team for my university, and kind of going off what you were just talking about. In your experience, what is the biggest mistake athletes make during injury recovery, and how can that be associated with wanting to be back playing their sport, as well as pressure from coaching staff or just kind of the situations that they're in time-wise, being a senior or trying to be recruited for grad school?
Yeah, I would say the biggest mistake I see is sometimes athletes don't talk, you know? So they don't tell me what their concerns are, So I don't know. Like I don't know that like the coach is putting pressure on them to come, to get back early and that's why they're pushing themselves through pain when I've told them not to push through pain. So I think that it's, again, everything you say to a physician should be in complete confidence. So it's not like I'm going to go to your coach and be like, "Oh, so you're putting, pressure on and I mean, so it but if I don't know those things, then it's hard to help. But, there are things I can do to get involved. Like I can go to the athletic trainer and be like, "No, they are allowed to do this, this and this." And if the coach asks why, you can say Dr. Robinson said so. And like I've told athletes all the time, like I had an athlete, coming back from an ACL, collegiate soccer player. Every metric said she was ready to get back on the field. She was not ready to get back on the field here. Like she was not ready. She was not ready. She was worried about getting re-injured. She was not there mentally. And I talked to her and I said, "Look, you don't have to tell the coach that you're not ready. Tell me you're not ready. And then I am the bad guy. And I tell the coach she's not playing. She's not ready. You know, and because I can't have you out on the field if you're not mentally ready to do so." And I think that's where we have become so much more aware of mental health and how mental health plays a role in injury recovery and sport. And so like that's why a lot of big, especially big time, have sports psychologists, have performance coaches, like what we call mental health coaches, to kind of help people kind of get back so that they're ready when there's an injury. But yeah, I mean, I think as athletes, everybody wants to push them. I mean, they push themselves, like that's what makes you a good athlete is the ability to kind of push yourself. And most athletes are used to pushing through pain, because it's part of being a good athlete. Like you push through pain and push through soreness and you push yourself to the limit, like that's why these elite marathon runners can run 2-hour marathons. It's if you look at their faces, they're in a lot of pain, a lot of pain. It's not easy, so that's kind of part. And sometimes again, you have to be the protector. You have to protect the athlete from themselves. And like I mean, I had a collegiate soccer player, female, you know disordered eating. She was sneaking out of the dorm room at 2 o'clock in the morning to exercise so no one could see her, even though, she had a stress fracture and had been told multiple times she couldn't run. And, like those are scenarios where like this is, like you can see this is spiraling. This is becoming a big issue and this is life threatening if she continues down this path. And so you have to step in as the physician and put boundaries and be like, I was like, I will put you in a cast from your foot to your chest to keep you from running if I have to. Don't make me do that. But like sometimes you have to like really have these tough conversations where you're like, you know, um, where like there are severe, like that. Like we were like, you will do weigh-ins with the athletic trainer. If you do not make weight, you will not see the field. Like if you are losing weight, you are not playing. Like that, there are no ifs, ands, and buts about it. There's no excuses. It is just this is the way it is. And you have to, again, you have to do that for their own safety and their own health. And luckily, it rarely comes to that point. Most people like you can talk to and you can communicate that rarely you have to get into where you're like, but sometimes you have to. And that's where I was saying, it's really important to be confident, but not cocky. Because sometimes you do have to put your foot down and be like, I am the authority here. This is what I say, and this is what's going to go. Because and you sometimes have to get there, and you have to be willing to do that. Again, and usually only when it's an utmost safety issue. But like I've had real conversations with athletes. Like, look, we're 3-20. You being on the field is not going to make us win a championship. Like, why are you putting your body out there playing injured, playing hurt? Like let's take a step back and look at things. And because we all say that it doesn't matter, it doesn't matter, but it does. Like if you cannot be a good sports medicine physician if you are not taking into account some of those external factors. Like it's part of it. So like yes, you will do things during a playoff run that you may not do during the regular season. And those are different conversations. And the reason is one, the stakes are higher, but also like if we're talking about the finals, I've got to get you through 3 more games and then you can rest as much as you want. If we're talking about the beginning of the season, I've got to get you through 36 games and a playoff run. Like that's not realistic with the injury you have. You got to take the rest now. Can I get you through another 2 or 3 games and then you can rest? Yes. Or like sometimes we all know there are things that need surgery and we just manage them through the season. And then you have surgery at the end of the season, because you're like, okay, you're going to have surgery either way. Like we can manage this and try to let you play through it and try to manage pain and symptoms. And then we get it fixed at the end of the season. Whereas, if you're in the off season, you get it fixed right away because you're like, okay, well, we've got time to recover now. We got time to rehab. Like, so it does play a role. And if you're not using that, you're not being a good sports medicine physician because competition is part of it.
Thank you so much.
Sorry.
Oh,
you
go. I just can't raise my hand. That's all for the
Okay.
most. That's the only thing. But thank you so much, Dr. Robinson, for such an insightful presentation. I really appreciated just the scope of things that you've talked about, emphasizing the importance of shadowing opportunities, taking care of yourself, and also just involving yourself in a variety of different things. I wanted to ask more about your experience in rodeo, specifically some of your biggest takeaways, and also like how you got into that. Was it that you shadowed someone and then like started rodeo? Also, with that, I know it may not be the biggest thing for a lot of athletic trainers, but do you see it as a potentially like growing sport that you believe that, young professionals like ourselves will be going into as the years to come?
Yeah, so I got thrown into it because I was at the University of West Alabama and they had collegiate rodeo. So it was one of the sports that I took care of for my athletes. And so knew nothing about it. I had never seen a rodeo event in my entire life. I had never been to a rodeo event in my entire life. I had no idea what the heck was going on. I was like, why are these women jumping off a horse? Like, why? This seems like the worst idea in the world. Like, so, you know, again, you just, like I learned, like I sat there and I talked to the athletic trainers that had been covering for a while. learned about the sport, learned about what, like what kind of injuries do you see? I mean, I can see some that I think are going to happen right now just watching them do this, but like, what kind of things do you see? And so yeah, they see a lot of like traumatic injuries, ACLs, ankle injuries, I mean, you're jumping off a horse, you know, that's at pretty high velocity that can lead to a lot of concussions, broken noses from the horse, like, or the bull coming back and hitting them in the face, you know, and I mean, I like to say my WNBA athletes are the toughest athletes I've ever taken care of. There's no compare. Rodeo athletes are the toughest athletes I've ever taken care of, and there is not even remotely any comparison. They will the things that they will play through. I mean, it's absolutely ridiculous. But yeah, there's collegiate rodeo, and then obviously professional rodeo. So it's definitely something if you're interested in. There are athletic trainers that, take care of it. There are physicians that kind of follow the pro rodeo tour and, serve as their physician. But yeah, just kind of a funny, kind of side note, like I said, you had to wear your cowboy boots, you had to wear your cowboy hat. So the first event for rodeo that I covered, I thought I was all good. I had I'd gone to the Western store, got my boots, my cowboy hat. I was in my, jeans and my flannel. And, I was like, okay, I look the part. At the end of the first night of the event, the athletic trainer walked up to me and was like, Doc, your hat's on backwards. No idea that there was a way to wear a cowboy hat where it's backwards or forwards, but I had been wearing it backwards all night long. And for people that wear cowboy hats, very obvious that it was backwards. And so obviously I thought, I was like, oh, I look the part. I'm fitting in here, and everybody knew that I knew nothing about like being a cowboy or being rodeo. So but again, it was funny. We all had a laugh about it. It's just, it just is what it is.
Thank
But
you
yeah,
so
I would
much.
say it's like, I so I did a Roy rotation at Boston University when I was in residency. And that was the first time I had ever seen field hockey. Coming from the South, field hockey is just not, it's not a sport that you see down there. And I remember I was watching with the athletic trainer, had no idea what was going on. I was like, I have no idea what's going on. And then they get to the penalty shot, and the entire defense lines up on a line while the offense is standing around this thing that looks like a 3-point line. And the ref blows the whistle, and one girl has her stick up ready to hit the ball as hard as she possibly can as the entire defense runs towards her. And I was like, who thought of this? Who thought this is the worst idea ever? Who thought of this rule? like, who thought of this, like, and said, oh, that's a good idea. Like, we should do that. But, it's every sport kind of has their, things that you like look at and you're like, you know, wow, that's like really high risk for injury. Like, why was that, well, who kind of thought of that? But that's the unique thing about getting to cover new sports is you find out, new things and um, new things that you like, and you know, and sometimes you find sports that you absolutely love that you never knew anything about before.
Thank you for that. Your experiences sound very fruitful and very inspiring. I appreciate it.
Chris?
Um, so I was kind of wondering, I know I watch a lot of hockey. I'm a hockey player as well. The NHL now has concussion spotters. I know
Hmm.
that you're at a lot of games. What role do you play in if you see an injury and a player tries to play through it? Will you ever take them out, or is there a conflict with the coach there? Just kind of that situation.
Yeah, I think a concussion is definitely one of those areas where we kind of sometimes have to be the bad guy, and not really the bad guy because we are protecting the athlete from themselves, but we have to be the one to step in because by definition of a concussion, it's a brain injury. They're not thinking correctly. They're not, so they're not doing what they would normally do, and so I love it having concussion spotters. With the W, we have replay. I love being able to, because you can't always see live what happened, like maybe you're looking at one direction. I mean, because especially in basketball, a lot of the collisions happen off the ball. So if you're watching the ball, you may not even see somebody get hit. Same thing with hockey, like you may not even see where somebody got hit. So that's where the concussion spotters are great, and they have them in, most of your collision sports. Hockey, NFL, rugby has them, soccer has them. And like what you're looking for is like that. You're looking for hits that could be indicate a concussion. So like when I covered, the Guardians and the Express, professional football, we had a concussions consultant, and sometimes, you would get buzzed down. Hey, 68 has to leave the field for a concussion evaluation, and so you just walk over to them. And the good thing is, I love these kind of rules because it takes it out of my hands. I'm just like, I go up to him like, hey, concussion spotter said you got to come with me. Like, don't argue with me. It's not my job. I didn't do it. And then, you do the full concussion eval. And if they pass everything, then great. They get to go back and play. But I remember one of my, when I was covering the Guardians, so I had been at HSS 2 weeks, brand new to the job. I was covering the Guardians. We were down in DC. The orthopedic surgeon that was with me was the chief of our sports medicine department. So a little intimidating that my boss was the person that I was covering this with. And, our running back goes in, hits, comes up out of the tackle, and he just starts, kind of stumbling around and heads to the sidelines. And so I pulled him off. And, and he was telling me all the right things. Oh, I feel fine. And I go, I don't care. I don't care what you tell me. You stumbled off the field like that, you're out. Like, you are out. It's non-negotiable. It's the rule. This is what the rule says. You are out the rest of the day, and we can reevaluate tomorrow. Like, and I was like, look, it's on national TV. Everyone's seen it. I put you back out there, I lose my license. No, we're not doing that. Like, this is what it is. And again, it's like, you're not being, you have to be confident in what you know. Because I know that is a sign of a brain injury. Now, whether he's feeling the effects of it now or not, that doesn't mean he doesn't have one. And this is an athlete I don't know. Is he being honest with me? I don't know. Like, I remember when I was covering a high school football game one time, and I was talking to the head coach, and I was like, I don't really know. He's acting really weird. And the coach goes, he's a really weird kid. And it's just, I mean, again, like, you don't know all the athletes, I'm like, he's saying things that are really inappropriate. And coach is like, yep, that's just him. That he just says things like that. But, and that's where you a lot of times rely on the athletic trainers, because they are with the athletes more. So they, spend more time with them. They get to know them on a more personal basis. And so sometimes they know. Or teammates. I've had teammates come up and be like, hey, so-and-so is not acting right. Like, they are not okay. This is not the way that they normally act. I remember when I was at West Alabama, we had a cornerback. I didn't see what happened. We don't really know. It was Division II, so of course we don't have a spotter. Cameras are kind of limited in D2. We still don't know. I still don't know exactly how he got hit. So none of us ever saw it. But he's like getting in a fight with everyone. Teammates, opposing team, fans in the stands. And like, the coach is like, this is not him. Like, something's wrong. Like, this is not him. So come to find out, he had a concussion. We don't know actually where it occurred, but like he's not himself. Like, he's not acting right. And so sometimes you have to, like, I had to rely on other people for that, because I don't really know him. I didn't know him very well. So, it's and that's where the team effort comes in. And everybody, and making sure that, like, that your coaches are educated. I mean, luckily now, I mean, you very rarely run into coaches that are like, I don't believe in concussion. Uh, that's very rare nowadays. Most of them understand, but you do have coaches that, we tell people you have player coaches. Like you have coaches that are very like pro player health, and then you have other coaches that are very pro winning, and not always do those things, are the same.
Kevin?
Hi, Dr. Robinson. Thank you for your presentation. It was really interesting to see everything. I just wanted to know, since you work or have worked in jobs that have international audiences, have you ever had an experience with one of your athletes? Have you ever had a language barrier? And how have you really tackled them?
Yeah, I mean, all the time. So, I mean, um, one of our players, Han Shu, is Chinese. And when she was in the Liberty, when I first started 5 years ago, her English was not very good. And so, you're trying to do a concussion evaluation on someone that has to remember words that are not in their native language, so like it can be difficult, and that's where baseline testing and stuff really comes in, so what their baseline is, so that then you can know if it's off. But like I tell our athlete, like that we have a couple French athletes, I mean, their English is great, they can communicate, but again, trying to remember a series of 10 words in a language that's not your native language is tough. Doesn't matter how fluent you are in that language. And so that's why I always tell them, I'm like, this is a baseline. I'm getting your baseline, so that if you were to get hurt, I can test you against you. I'm not testing you against the rest of the team or anything like that. But yeah, and then sometimes you have, like we talked about, like medical care is not standardized, around the world. Like there are things that are done in other parts of the world that aren't really done here. And so sometimes you have athletes that ask you for things, like I've had them ask me, like, I don't even know what the hell that is. Like, I don't, I have to go look it up. Or they'll give you a medicine and you're like, we don't have this medicine over here. I don't know what it is. I got to go look it up. And so, again, I think being honest, being humble, being honest about those things, that this is something that's different. I'm open to learn about it. I'm open to learn about like what you do, and and why you do it this way. But like it's not something that we do here. This is not kind of standard of care here. Um, but like we all see, these, you know, the World Cup, it's gotten better. But you see these countries run on the field with this cold spray, spraying it all. I mean, like, what the heck is that doing? Nothing. I mean, numbing it for like 5 seconds. But I mean, but that's like, again, so you have these soccer athletes that are like, "Where's the cold spray? Cold spray?" And I'm like, we don't have cold spray. We don't do cold spray. Like, so it's just cultural differences and things like that. I will say, nutrition wise, it's a huge deal. As you have people come from other cultures that may have different nutrition, and then they're here in the States where they can't always get the food that they're used to. And so that can be a huge deal. Obviously, not as much for the Liberty, because we live in New York and we can get pretty much anything that we want for our athletes. But at the college level, where you have athletes come in, especially like when I was in like I'm in rural Alabama, and you'd have like you know French athletes come, and they don't want to eat fried food and barbecue all the time, and but that's what they've got available. That can sometimes be a challenge. But again, it's communication, it's finding culture, again the way different cultures kind of look at things, and trying to understand it, and make yourself aware of it, and not necessarily make judgment on it, because it's not your job to judge the way. You may not agree with what's done, but you have to try to come to some kind of understanding about it. I always say I always had a tough time with our when I used to take care of like a lot of soccer, I used to take care of a lot of English athletes. um Mental illness there still has a big stigma. And it's not as widely talked about, widely accepted, like, so people are not very forthcoming about like depression symptoms, anxiety symptoms. I had a male soccer player from England that was like acutely bipolar, like bipolar one, like completely manic, and trying to get his parent, like, to convince his parents that like he had to come home and you had to get him into treatment. Like they were like, no, no, Americans just think everyone's crazy. I'm like, your son was in an inpatient psychiatric ward for 3 days. Like, this is serious. And then they're trying to blow, oh, he's not playing as much as he likes. I'm like, okay, that's fine. Most people don't threaten to lock themselves in a room and threaten to kill themselves over not playing the way this is not a normal response to these things. So I think, again, it's like, and again, it's something you had to put the foot down. You had to be like, look, he is coming home and he is not coming back to school here until he is under treatment of a psychiatrist on medication, and has a plan of care. Like, these are non-negotiable, and that he never came back to school. Um, and and then I remember our coach, the men's soccer coach, he was like, "Hey, I have a question for you," and I was like, "Okay." He's like, "You remember so and so?" And I was like, "Yeah." And he's like, "Well, I got a call from another coach. He's trying to play there. What can I tell them?" And I'm like, "Well, you can't tell them anything, because of HIPAA violation. Like, you can't tell them anything about his, health." I was like, "But you can tell him what happened on the field. You can tell him he punched a referee in the face. That that's not HIPAA violation. That's something he did on the field. So you can tell them that." Um, you know, but I was like, don't mention anything about like what happened, or, where he was treated or anything like that, And if they're smart, you know, like that, when I talk to athletes, if I'm not getting the story that I really want, I'm like, okay, I need to get your medical records. So I need you to sign a medical release so I can get your medical records, because something's not adding up here. I remember my first year with the Liberty, one of our draft picks we were looking at, so one of the things you do for professional teams a lot is you evaluate draft picks based off their medical injuries and things. And so you give the GM kind of your advice about like what kind of injuries they've had and how that may affect them like going forward. And I remember one of the athletes we were looking at, no medical history, no injury history, said had never been injured. And then she's on Celebrex twice a day, which is a pretty high dose anti-inflammatory. And it's like, well, if she has no injuries, why is she on Celebrex? Like, so that's not adding up. Like, we need her medical records. And then come to find out, she had her knee was swelling, every day after practice. And, I mean, so those are the kind of things that you kind of, with experience, you kind of pick up on subtle things when maybe people aren't being as honest with you as they really should be. And again, we ended up drafting her. It was no big deal. It's just like, we need to know. We need to know what's going on. But again, it's a job. So, the athletes are also worried. They feel like, okay, if I'm injured, no one's going to draft me, no one's going to pick me up. So they have their own kind of, concerns.
Thank you for that.
I'm so sorry, I'm not being able to raise my hand, and I have a quick question.
Yeah.
I thought it was so interesting when you mentioned rodeo. I come from a family of professional rodeo bull riders, and yeah, and a lot of the times I've seen uncles and cousins when they like had injuries or they had concussions, they believe that they were tough guys and bull riders. They fall and we don't feel anything. How do you like treat a patient that sometimes is not willing to be treated?
If you have the answer, let me know. That is like probably the most difficult thing, and I completely agree. Like those guys, you would be like, you have a concussion. Oh no, no, I'll be fine. no, that's not the way concussions work. Like you know, like that's just not the way they work. Um, but yeah, it's tough. And I think, again, um, I've gone back a lot to rapport and again, like having that rapport with the athlete where they genuinely know that you have their best interests at heart, like that they genuinely know that you are wanting to do what's best for them. And like telling them, hey, look, like this is dangerous. Like this could do long-term damage. This is something that you can, I like one of the worst things I've ever had to do was I had to disqualify an athlete, because she had too many concussions. And but we're at D2 softball. She had like 7 concussions and each one was getting like worse and worse. And I was like, I finally was like, why? Why are you doing this? Like, you are not going to make a career out of playing softball. Like, you need your brain. Like she was like that. She was like an athletic training student. She was very good. I'm like, you need your brain, like, to function for the rest of your career. And then when you start talking to her, she's worried about losing her scholarship. And if she loses her scholarship, she can't really afford you know, to stay in school. And then she's worried about, she's never not been part of a team. She's worried about not being. And so, you know, so I went to the athletic director, went to the softball coach. I said, look, I have serious concerns about her continuing to participate. Like, she's had a lot of concussions. They're getting worse and worse. But here are her concerns. And the coach was like, easy. I'll make her a manager. I'll keep her on scholarship. I I don't care. So then once you break those hurdles for her, you know, and you're like, okay, look, you're still going to be around the team. You're going to be managing. You'll help the athletic trainer. You'll get some experience doing that. And then, you're going to be managing the team. You're still going to be going on all the road trips with the team. And then you're still going to have your scholarship, and the school was willing to honor to that. Now the only thing is, like that, I had to medically disqualify her, so her scholarship didn't count against the scholarships for the team because NCAA rules, they have only so many scholarships per team. So once I disqualified her medically, that no longer counted against the softball scholarships. So that opened up that scholarship for another athlete. But the school, just honored her scholarship anyway and kept it. And so again, you never know, like you never know what's going on in somebody else's head, or you never know what somebody else is dealing with. And so you know I never try to, you know I always try to look at it from the athlete side and like, what do where are they coming from, because like that, like you're talking about, a lot of that is ingrained. That is family ingrained. You are tough. You do not cry. You do not show weakness. You do not show, I mean, and that's been something that has been ingrained since they were young. I always used to say, growing up in Alabama, my father's favorite saying was cry and I will give you something to cry about. Like that's the type of like, and that was very common down there. That's the type of environment you grow up in. And in it's and so you have to like understand that where they're coming from, like they may be worried about letting down their family, or if they do come out because they have a concussion, they may, they may be called a weenie, or or worse, or and so I think that, or a lot of times, especially in the team environment, they're worried about letting down their teammates. They think that if they're not going to play, then they're letting down their teammates. And again, you have to kind of sometimes, let them come to the realization that they're they're not going to be at their, like I told a high school coach one time, their quarterback like had a concussion, and he was like, "Are you sure?" I was like, well, he doesn't remember the last 4 plays he ran, so he's either got a concussion or he's a very bad quarterback. Either way, he does not need to play. So, I mean, again, like as a quarterback, if you're not thinking, like you're not going to be helping your team, you're only going to be hurting your team. And so if you're out there 80%, that's not helping your team, like that's just hurting your team. And so I think making sure they understand that and realize that. And that's where, it's great to have mental health professionals that can help, because they're very good about, having people realize, because what you want is you ultimately want the athlete to realize it themselves. You don't want to tell them. You want that, you want to lead them, lead the horse to water so it drinks. You don't want to just force water down its throat. Like you kind of want them to come to that realization themselves. And sometimes it's kind of, those subtle things. And when it comes to physical stuff, a lot of times I just, we test them, like, okay, you sprained your ankle and you think you can play. Okay, I want you to run 10 yards as fast as you can. I want you to plant to the right and cut. And when they can't do that, they're like, you can't play soccer. Like that, if you can't cut, you can't play soccer. So you make them realize it themselves by putting them in like a protected environment where you can control what they're doing. And then they realize, no, this is I can't, this is not something I can do. This, it's too bad. And then sometimes again, making them understand the longer term, because mostly athletes are concerned with the short term, short-term gains, this game, winning this game. And so, like that, like you might have an ankle injury and you're like, okay, look, you play on this, you may be out, you may make this worse, and this may be a 6-7 week injury, where if you rest it and treat it right, it may be 2-3 weeks. And so making sure they understand that, and and then there are certain things that that you definitely can play through, like there are, and I'm I make sure my athletes know that, like, look, the risk of you doing permanent damage is low. If you can tolerate the pain, you can do it, you know? So like that, covering pickleball this last weekend, unfortunately, they had an unfortunate incident where the video board collapsed in the wind and it actually fell on a player. And luckily, I mean, she didn't have any major damage, but she's just bruised, like the board scraped her up. She's bruised. And I'm like, that's what I told her. I'm like, look, like this, this is going to hurt, but it's not going to do permanent damage by continuing to try to play. If you think you can play, you can play, and sometimes the athlete needs to hear that too. They need that reassurance that you're not going to do anything, further to it. One of the things that I always, I have told multiple athletes, I don't expect you to play injured, but sometimes I expect you to play hurt. So those are different. There are injuries that can be bad and cause long-term consequences. And then there is, you have pain. And sometimes I'm going to expect you to play through that. We tell people all the time, the end of a WNBA season, find me an athlete that's not in some type of pain, find me one that doesn't have some type of pain or is nursing some type of like little minor injury. It just doesn't happen. Like, part of playing sports is playing through pain. That's just kind of part of it.
Thank you.
I tell my marathon runners, I'm like, if a marathon didn't hurt, everybody would do it. Like, it hurts to run 26 miles. Like something is going to be hurting by the end of it. That's why not everyone can do it. So,
Thank you.
For Lopez, if you have.
Breaking up, Sidhan, but I'm assuming you're deferring to me. I hope everyone can still hear me. Thank you very much, Dr. Robinson. That was exciting. I think going over the scope, as some of the students did say, from when you started to where you are now, it gives them a good idea of the exposure one has to have to even just think about even deciding on a sport or maybe falling into the sport, as we have both have. It's almost like a default. We end up covering, the next thing you know, you're playing, but you're covering it, but then you're actually in charge of it. And you're in a finite world here. Like you want to play more, but they're asking a lot more other questions, and it's very challenging. I think some of the points you did bring up on covering the athletes, deciding on when you can pull them. I think these are all great experiences that, fortunately, you can comment on knowledgeably of how you dealt with them. I think what happens is that all these young bucks have a lot to experience still. They need to see a lot, and the importance of that is what you've culminated here. And all we could do is thank you so much for bringing that together.
Yeah, I mean, I think that's probably like, as we talked about, like no one knows everything. I don't know everything. I am still learning every single day. Every single day, I learn something. Somebody teaches me something. A patient teaches me something, you know, and that's what being a physician is. You are a lifelong learner. Like that's what you're signing up for, because medicine is constantly changing. And so you have to be willing to change with it, and you have to be willing to learn. And I've had patients that have taught me things, you know, like in listening to patients, like just listen to them, and don't dismiss them. Like don't dismiss just because they don't make sense to you or those symptoms aren't adding up. Like I tell people a lot in my office, like, look, I don't know what this is. I don't know, but we are going to work to try to figure out. We're going to work
You have
together.
to
We're
be
going to do
honest.
testing. We're going to try to figure this out. Like, I'm not dismissing, just because I don't know what it is, I'm not saying it doesn't exist. We're gonna work through those. And I think um, when you see physicians that struggle, a lot of times it's an overconfidence. Like, yes, you have learned a ton, through medical school, through residency, the amount of information, like people say, medical school is like trying to drink water from a fire hose. I mean, like the amount of information that is bombarded to you is significant, but you don't know everything. You never know everything. And I mean, like the physician that I am now versus the physician I was when I first started, I mean, night and day. Like I have so much more experience now. I know so much more. And like that, like I learned things from patients, things I missed, you know, like I had a collegiate soccer player that, had this vague thigh pain, could not figure it out. I could not figure out what was going on with her. Looked at her back. It wasn't her back. It wasn't her hip. I just finally, I was like, okay, we're just going to need an MRI of her femur, and just, I don't know. And then she had a femoral stress fracture. Completely atypical presentation in every single way, shape, and form. Her symptoms did not match up with that in any way. But now, when I have an athlete that complains of like vague thigh pain, it's on my radar. It's maybe not the very first thing I think of, but it's on the differential. I have it back there. And I found 3 or 4 more in my career that if I had not seen that patient, I would have missed. So you learn from your patients, you learn from their experiences. And like that, like you have patients that, like I had a patient, the other day that came in and she's like, I've seen 3 different doctors. They all say it's my arthritis. I've had arthritis for 10 years. This is not what arthritis feels like. Like this is something different. And come to find out she had Lyme disease. So, it was different. It wasn't her arthritis. And so again, just like listening to the patient and and um being willing to be taught, being willing to find out something new. Um, and then like especially right now where you are in your careers, I mean, you should should just be like sponges that are, just taking everything up that is presented to you. Um, and because I tell our fellows that all the time, I'm like they come and rotate with us, and I'll be like, look, we have 19 faculty. They will probably show you 19 different ways to do something. Soak it all in. Soak up every single one of them, and then that way you can figure out which way you like. And maybe you take little things from each one, and because again, like I said, I'm a huge multitasker. Like when I'm in clinic, you know, it's boom, boom, boom. I'm seeing patients, I'm doing notes, and then I leave clinic, I'm done. My notes are done. I don't, but I have colleagues that they will, they like to chit chat with their patients. They like to talk to their patients, kind of like, how's your family? I don't do that. Like, that's not me. Like, I'm there, like, we're here about your knee. Let's focus on your knee. But then they have to like finish their notes at home later in the day because they couldn't get to all of them during the day, so those are give and takes that they find. And like that, I have like there are patients that are going to want to see those kind of doctors because that's what they like. And then there are patients that weren't like, my clinic runs on time. Like if I'm more than 15 minutes late seeing you, it's an abnormal day. And all my patients know that. So like, there are going to be patients that come to see me because they want to be on time. They want to be seen at their appointment time. And so, and there's not a right and wrong to that. It's just different ways. And that's fine. Different ways to practice, different ways to do things. And like that, you're not gonna, if you end up going into sports medicine, whatever field, athletic training, physical, you are not going to like every athlete you treat, and every athlete you treat is not going to like you. And that's okay. Like I have had athletes and I'm like, oh my God, I don't want to see this person today. Like it's just like we don't jihad. We're not in the same spectrum. This is not somebody that I would ever want to hang out with, but that doesn't mean I treat them any differently. You still have to treat them. You still have to try to develop that rapport with them but you're not gonna get along with everybody you come in contact with.
On that note, we really appreciate you coming on, and not only that, sharing your experience with us. The opportunity for you to come and just give them an insight to what you encounter daily is really something, I don't think they get a chance to really hear a person's experience to bring them to where they are, the culmination of it to get to where they are. And we just got to thank you so much for joining us.
Absolutely. I thank you so much for having me. This has been a blast. So I've had a great time. But encourage you, get out, shadow, find physicians where you are, email them, talk to them, tell them you're interested. I mean, that's what we do. I mean, we were all in your shoes once, so we know what it's like. So get out there and get experience and figure out like what it is that makes you passionate and what you want to do.
Perfect. Thank you so much, sir.
Well, y'all have a great night. It was very nice talking with you.
We'll catch up. Thank you so much, Dr. Robinson. All right.
Okay.
Thank you.
Bye.
I'll conclude week 5 of the Rice Institute and Rugby Research and Injury Prevention Group Summer Lecture Series. We would like to give a big thanks to Dr. Robinson for joining us today and everyone in the audience. Thank you all for attending.